contact and link people from different spheres. And at the same time, it's also about universities where you can conduct many activities like inviting people and conduct meetings from people from the field and provide more information for them, including employers. Still, we can say that we are not recognized. Hello, please take place. You are welcome. There is a problem that we are not recognizable as a unique field. You know, we speak about interdisciplinary, we can speak about biosocial perspective. On the other hand, in practice, it's still fragmented. I mean that many people in the field are trained as a psychologist, as a nurses, as a medical doctors, and we can speak about addiction psychiatry, addiction psychology, addiction social work, but in fact, it means that it's fragmentary. It's not unique field, it's not joint field what we share together, and at the same time, I think that we definitely need this perspective, that it's unique field and it's not only about psychiatry, it's not only about social work. At the same time, it means in practice that we need some place where these people can meet together and speak about these things with no limits, with openness, with academic independency. By the way, it's also about our field unique infrastructure. Hello, I will wait for you. Yeah. Because usually we think about our field from perspective of our original training, of our original education. I mean, for instance, I'm a clinical psychologist and I'm organized and I'm member of clinical psychology professional society. We have many specific things in addiction psychology, but right now we are speaking about something really unique, something specific. We have first national and international societies specifically dedicated to addictions, what is a little bit different from the original perspective. At the same time, in some countries, we have not only societies, we have also addiction libraries, focused on addictions, especially in the US. On the other hand, in many countries, we have very similar libraries. We have research and academic institutions focused on addictions, specifically on addictions, not only public health, mental health, and other areas, specifically on addictions. And as you can see, we can speak about exponential growing numbers of these institutions in the field. I mean, service providers, but also in academic sphere like universities, research institutions, and professional societies. We can find and identify first professional societies, as I mentioned before, and right now we have also first a real international professional society called ISSUP. You are on ISSUP conference. ISSUP is our core partner for ICUDDR, and ISSUP is a professional society for professionals specifically in addiction field. And doesn't matter if you are medical doctor, psychiatrist, if you are a clinical psychologist or social worker or nurse, all of us, we have one umbrella, one international professional society. You know, it's really important for our self-identity, for self-definition, who we are. If we are psychologists, psychiatrists, or if we are addiction professionals. That's a little bit different. At the same time, we try to identify first universities with first academic programs specifically dedicated to addictions. We have started at its Amalie turn and Amalie work, and she led the small team. It was her PhD, and we try to monitor and identify universities in different regions with addiction-specific programs. We have started with Europe, and you can find all results. By the way, in Europe, we have 34 academic-specific programs. We continue on universities in US. In US, it's totally different story. They have almost 400 100 academic-specific programs. And right now, together with Bill and with Kim and Isidore Obot, we try to finalize the paper about African programs. And we are able to recognize 8 academic-specific programs operated in Africa. Some of them have first evaluations. And what is really good news, some of outputs were published in international journals. And it means that also in Africa, we have first programs operated at a graduate level. And we have also many programs what are not academic graduated level. They are undergraduate and they are trainings. On the other hand, it's also beginning and it's also valuable into our family of universities. I will speak about it later on. Back 3 years ago, where the idea was born, it was on meeting in Honolulu in 2016, where we met as representatives from different universities, and we tried to figure out what's going on, what happens, and how to figure out what we can do to each other. I mean, the mutual support and exchange the, knowledge and our experiences and how to help each other. And it was probably very logical and expectable to create the idea, yes, let's start to create some international association of universities, association for academics, how to support each other and how to help us. I mean, we have a very different experiences with practical implementation issues. We have many different implementation models. Some of universities have their own curricula. We have our first international curricula. I will speak about it later. But on the other hand, we have a first universities with their own curricula. Some of them try to mix it together. Some of them try to develop their own curricula. Why not? That's not a problem. This is the establishing group. And I can list it, the goals of ICUDDR. As I mentioned before, the number one is networking. We definitely need to know more about our programs, our experiences, and create an international network. It has many consequences. For instance, it's very easy. In such case, we can speak very easily about Erasmus program, exchange for students, exchange for teachers. It's logical, and that's university do. Education, how to engage students in addiction studies, because we need to offer to students, to young people, that we have something valuable, something where they can work, what is enough stable. If there is a real labor market, real working positions on a labor market, what's the logical and expectable question number one? Of course, if I will study your program, where I will do and what I can do in practice in the field. Do we have enough information about employers, about matching the employers and their wish and our graduates' profile? And that's logical also in terms of lifelong education. If you provide undergraduate and graduate program, you have to, you should to offer also something more, something in lifelong education training for your graduates. And of course, as I mentioned before, we have to also link it to research and to be enough interesting and enough attractive partner for employers. They need evaluation, they need more information, they are seeking for information, and I think that we can provide it. We are universities and that's our purpose to do it. Of course, we can speak about community outreach and creating this partnership with employers, with national professional societies. You know, again, we are speaking about building step-by-step national infrastructure in our countries, and without this infrastructure, we cannot be successful. What we can do without professional society, without employers, without governmental support, we definitely need also advocacy and advocating for our university programs and for our graduates. At the same time, I know that it's too soon to speak about guidelines, speak about quality standards. On the other hand, it's question of 5, maybe 10 years, and we should to speak about it, because our programs in one time probably have to be comparable, because if we are creating unique field, maybe some of our graduates will moving from one country to another country and take these positions in services in different country. And it means that it's crucial issue for us to have a comparable programs, not competitive, because there is no, you know, in next decades, there is not possible to speak about competition. You know, we have so limited number of programs, and at the same time, the problem is growing, that we have enough work, enough services for our graduates, and we should collaborate, and there is no space and there is no reason to speak about competition. Who are ICUDDR members? We have many different member universities, and I think that it's good to make it clear, because we have, for instance, universities with just particular programs, with particular subjects. For instance, they have a psychology program or psychiatry program, and they have just a couple of courses, couple of subjects dedicated to addictions. That's what we do, and that's just beginning. On the other hand, we have also universities with much more specific activities, for instance, with summer schools, winter schools. Very good example can be San Diego Summer School, what is really famous. Amsterdam Summer School, also very famous activity in lifelong education context. On the other hand, we have also third category, and what is probably purpose why you visit this, this workshop and this 3 days training. We have first universities with fully academic degree addiction specific programs. Some of them have a master program, some of them have also bachelor program. We have first colleagues with planning or operating PhD programs. In some countries, we have different models, but we have first complex programs focused and specifically dedicated to addictions. I mentioned members before, and right now we have 121 member universities, and I should to explain it because we have no individual membership. ICUDDR is a body dedicated to universities as organizations, as institutions. It means that we have an institutional membership. It means that our members are universities, not individuals. That's the difference with ISSUP. You know, our purpose is how to support and how to work with universities as institutions, not supporting of individuals, and we are not a professional society in normal way, in normal meaning. We have universities from 42 countries right now. You can visit our websites, maybe you did it, and find our membership area and join us. It's a homepage from, and you can see and you can find all basic information about ICUDDR and how to become our member. I mentioned that we have many different curricula. Our core product, if I may say it, our first real international curricula. You know, it's really important step, because in former times, every universities had just their own curricula, what are local, national. But right now we have a first model, first real international curricula, and we can compare it. You know, it's a really big step, because right now we can compare what we share, what not, what is not content in prevention, if you have some overlap in treatment, harm reduction, risk reduction, if you use enough theory, for instance. Many questions arising from this comparison. On the other hand, it's really important step that right now we have a first model curricula for prevention, treatment, and recovery. It will be really soon. We have a first adaptation into adaptations into the national languages. You can see many countries where this process happened or happens right now. And I also would like to take opportunity to invite you for next year, for our next meeting, because we are planning a first annual ICUDDR conference in Peru, in Cusco. And that's a little bit different area and a different meeting, different conference, where we try to speak more specifically about our programs and our experiences. And of course, you are invited, and we will be really glad if you join us, if you will join us. Let me tell you a couple of words about our planning program for today, for tomorrow, and for Wednesday. As I mentioned at the beginning, right now we try to focus more on local experiences and local activities, because we spent a lot of time in a lot of discussion about international context. But we have decided that it's really good time to be more focused on regional and local context, and be more specifically focus on your own experiences and speak about examples of good practice. That's the reason why we start with Canadian University and their experience. And the second presentation for today, the session will be dedicated to situation in Nigeria and their education programs. As you can see, Tuesday program, tomorrow program. After summarizing of Monday, we will speak specifically about education in South Africa. We will continue on session specifically focus on Tanzania, Botswana, and Mozambique. And after the lunch, we will speak about a very important issue, and especially US right now is a very good example how important is to have a minimum education in addictions for other area, for other professionals. I mean, for example, what's the minimum education specifically in addictions for medical students? Not only for psychiatrists, generally for medical students. And as I mentioned, US, the opioid crisis, it's a very good example that we are really underestimated this issue, and we are not on the level of minimum knowledge, skills, and competencies for students in different areas, and we didn't define what's the minimum for other professionals. Just skip it. And for tomorrow afternoon, we have a master class, and it will be very specific master class, and I'm curious what will be your reaction, because it will be first time when we will open a discussion about implementation process. And I listed step by step what we should to do, what we should to know about implementation, and open discussion about very specific issues like our universities and our countries are in very different phase of development. At the same time, we have very different conditions, very different legislative background. And it means that we have to be very careful how to implement the real program on real universities, how to develop our local partnerships, our local networking. And we will go through this process tomorrow afternoon and speak about it. And it's just beginning of the process. For Wednesday, we will continue on discussion and examples of good practice from Ghana, Rwanda, and Senegal. We will speak also about Thailand's experience, what is very interesting international master program, and I think that it will be really attractive to you. Sorry.